estamos de regreso del
Very well,
break.
we're back from our short break. And thank you to those of you who are joining us now. I want to remind you all that there is simultaneous interpretation available at the bottom of the screen under the interpretations button that you see on the right side bottom of your Zoom screen. As I mentioned, the Q&A or chat is available for you to ask us questions, or you can also raise your hand when we're doing the presentations. I'd like to introduce our next speakers, the group from Bolivia, who's going to talk to us about their experience in a communication strategy for contact tracing, which involved different indigenous communities from the Bolivian Chaco from the very beginning. And today, Francesco Cosmi, Director of the Health Treaty of the Church's Social Work, Sandia Padilla, from the mobile team. He's a Petori social communicator from the Health Treaty. And I want to thank you all for being with us here today. Francesco, I'd ask you to, before you begin, I'm going to start projecting your slides, but can you tell us a little bit more about the work of the social treaty or convention, Convenio Social? Thank you, Tania, for this presentation, and thank you all for giving us this opportunity to share our experiences here in Enchaco in Bolivia. As Tania was saying, the health treaty or agreement is a social pact, which we've had since the 70s, thanks to the work of Father Narciso, a Franciscan priest who began to work in health and trying to find public health strategies, also hand in hand with the indigenous communities of this territory. The El Chaco, the Bolivian El Chaco, is a pretty large territory. We know that it is shared by Paraguay and Argentina and Brazil. And then the Bolivian side, that's about 128,000 square kilometers. And a pretty small population, it's only maybe 300,000 inhabitants who are concentrated mainly in the cities. Of these, a third of them are indigenous populations, especially the Guarani populations. But there's some in Tarija, in Bonaire, and Tapieca. As I was saying, it's a very large territory with very little infrastructure. The whole territory has only one asphalted road, which goes from Santa Cruz to Argentina for international trade. And then the rest are all land roads towards the communities, pretty remote, pretty neglected. To give you a little bit of context of the activities we've done, we'd first have to begin by telling you how the pandemic arrived in the Guarani communities. Well, first of all, I wanted to give you an example, really, of some of the indigenous organizations' examples, where they said that in this pandemic, we're not all on the same boat. We're all in the same water. We're on yachts, we're in boats, we're in lifesavers, and some are just swimming away. And so just to tell you that in Enchaco, it was already difficult from the beginning. We have a chronic difficulty, a very little access to water. Most of the communities and atajados, which are artificial lagoons or lakes, are the only places where they can save the rainwater and share it with the animals. And that causes several health problems with some of the postas, which they have, the mobile postas, are not equipped to deal with that emergency situation. Especially at the beginning of 2020, the situation was terrible. They didn't have gloves or masks or alcohol, so the situation was pretty complex. And we're dealing with a population that has different basic chronic diseases, and the one best known and maybe the most neglected is the Chagas disease, which is an endemic disease in this territory. And it's not often seen. It's one of the most hidden diseases. Now, aside from that, we also have hypertension, diabetes, epilepsy, malnutrition, particularly child malnutrition. And during the pandemic, that has been most neglected because there's been no care, no drugs, nothing. From the beginning of the pandemic in 2020, we began to establish some type of communication mainly focused on the urban areas with very few interculturality, not only due to the language, but also due to the context of the biosafety measures that were being implemented. So the organizations in these communities joined and tried to find solutions with what they had. The first step was to close access to these communities, as you see on that picture, to avoid spread. They recovered the traditional medicine, first because, as we say, these communities trust this medicine more, and also because it was the only one they had available at the time. And there's a very interesting experience in the chipi plant, which was used often to counteract the symptoms. And then the serious problem was, someone has a microphone on, the equipment of the health center and the training of these. So the communities, thanks to the health agreement and PAHO in 2020, set up a project to strengthen the equipment in the health centers and training the health staff, and strengthened also the community protocol to counteract the disease. So from 2020, we can say that we were at least able to reduce access to the communities. Now, starting this year, 2021, next slide, please. In Bolivia, we received a third wave of the disease, which has been the worst and has coincided with the winter season. We had a very cold winter and has led to a larger number of cases, many more cases in the community. That's why we've had to work more and had to strengthen the contact tracing and monitoring as a strategy to reduce the spread of the disease. And we've worked with two main components. The first was training and strengthening the tracing. There was a national protocol, but it wasn't being implemented. It wasn't being given the necessary importance to reduce the contagion. And the other part of the communication, as Tanya was explaining before, it was to have to fight against the stigma that's been created around this disease and the denial of the disease. So we have to work with risk communication, with intercultural material prepared to mitigate the impact of this disease. Next, please. Now, those two spheres, and I'll let my colleagues speak in a minute, insofar as the strengthening of the tracing and monitoring, one of our key actors were the health promoters. The health promoter and the people who have acted as a bridge between the hospital, health, and the community. It's someone from the community, and he knows the language. They speak Guarani. Their second language is actually Spanish. So the health staff and the health promoter was chosen by the community itself to offer them, to help them. And he does volunteer work, always in coordination with the health personnel. This health promoter's figure has been key to our access and acceptance from the community. On the other hand, insofar as communication is concerned, next please, we've seen that the key strategy has been the use of radio as the main tool to reach the communities. The WhatsApp and the megaphones are always accessible, but the radio has been fundamental for us to actually access a territory which is much larger than we expected. We've worked in 62 Guarani communities, but with a radio, we've been able to reach a lot more. And it's a participative radio, actually, where the health promoters and the authorities managed the message and spoke about the topic. So at a community level, we heard well-known voices and also messages which were related to the reality and often in Guarani. That has been, I think those have been the two main components that have helped us. And now I'm going to give the floor to Licenciada Sandra Padilla, who's a Guarani anthropologist, so that she can explain some of the specific activities that took place in the community. Thank you very much. Good morning or good afternoon to some of you. Can you hear me? Well, continuing now with the presentation, I'd like to share with you some of the activities that took place in the Chaco, the Bolivian Chaco. I'd like to introduce myself, Sandra Padilla, and talk to you about some of the activities developed in El Chaco, which were mainly based on the needs of the communities. And 156 participants, health promoters and health staff, participated on different subject matters, which had the community in mind, hoping to replicate the knowledge of these health promoters and health staff to bring new knowledge about this problem of COVID, which it was initially unknown in the communities. However, as a result of the training, we've managed to understand and have the communities understand using different types of teaching methodologies. As you see here, we have some material prepared by the health staff after training themselves on some of these subjects. And one of their tasks was to convey the information to the communities, adapting the material to help the communities understand the question of the vaccine in this case, showing the positive cases that we see there with the little red dolls and the negative cases with the green dolls. And this material helped the communities understand the danger of this pandemic. However, the training of the promoters and the staff was important prior to these activities in order to actually be able to help these communities. Here, I show you the trained health staff on the nasal antigen tests. This training meant that we had 72 trained staff, which helped them trust themselves and trust in being able to do the tracing and the testing for COVID-19 in the different communities at the people's homes. So this was actually not known in these communities. The World Health problem was something that these communities had never heard of. So thanks to this training, the people were able to go to the homes of all these people, 100% of the homes, in order to find new cases, which at the time the community would not have known and therefore would not have probably reported the cases, because Up until that moment, it was taboo, as you can probably imagine, culturally speaking, and it was an unknown health problem. But through the different methodologies like videos and pamphlets in both languages, in Guarani and Spanish, as Francisco was saying, they were able to understand the problem. On this slide, we're showing you the guideline which was prepared by the institution with the help of PAHO on the contact tracing and monitoring for COVID-19. We realized that the simple word of tracing and monitoring in the community was already a fear for them because they knew nothing about it. So one of the activities of the team was to make them understand what tracing and monitoring meant. And once the communities were able to understand what this was all about, they began to report and guide and orient based on what's in the guide. So another thing that was important was to share with the health staff and the health promoter, because they're the ones who, after receiving their own training, are able to then convey that information to the communities. And coordination with them was very important so that one could do joint activities in these communities so that we could actually bring them the information based on the teaching materials that we had available, which were very useful in our communities because they focus on key elements and on important aspects of what COVID is, how we can take care of ourselves, how we can organize ourselves in the communities. And here we see how we've worked with the guide on COVID prevention. First, we took advantage of the care spaces, the healthcare centers for the community. But also, while they were being cared for, we took advantage of that time to guide these communities who were waiting to be cared for.
That's why it was so important for us to offer this guidance to the community, that is our health, the health information as well as contact tracing information, because since we already had the community there with us, we were able to convey this message and make sure they understood it using this didactic material, which we put together, tailoring it to the culture, to the language, to the unique characteristics of this community. Then we distributed it to the community. What you see here is that there were 63 communities, 48 health centers that received this biosafety, basic biosafety and equipment information. People were fearful before. They didn't trust that they could go to the health center. But after receiving this educational material, they were less wary, and we were able to go to people's homes and carry out whatever intervention was necessary. And that makes it easier for the healthcare workers to carry out their jobs in a more normal way. The healthcare personnel of the location are key parties that can help a lot for prevention. Of course, we offer training on contact tracing. Again, that made it easier for us to be able to work closer with the communities to capture more cases, follow up on the community and families. What we said before is how important it is for there to be coordination between the healthcare professionals and the community to provide the community with good information. We're talking about community leaders, local people who know their communities very well. These are all key people, players who can really help us offer care and preventive guidance. That's why we work very close with all of these people. Oftentimes, we have to work with the different areas. And all of this is to ensure that people don't come into contact with suspect cases. The community understood very well. We've lost the audio. It's freezing, says the interpreter, breaking up. To prevent more cases, more spread of COVID-19. Welcome, everyone. I'm the person in charge of outreach and communication for our project. There are two components. We have training, as well as concrete and specific activities that we carry out. I'm talking about contact tracing and then communication. And we'll be talking about mostly the second component. It's also very important to stress different actions. The speaker is freezing, the image is freezing, and the audio is intermittent, says the interpreter. So I will do the best I can. This all happens within the context of the communities, in this particular case, indigenous communities. One of the activities that we offer is training. Isabel, I don't know if it's only me, but there seems to be an audio problem. Could you please confirm that for us? Maybe I'm too far from the mic. Try again. Hello, can you hear me? Well, let's see. Yes, well, let's see how this goes.
Como les decía, en el componente que ha sido el componente en el cual
Again, says interpreter, the sound is two-thirds silent, one-third disparate words. We work with the different indigenous communities, some of which speak Guarani. The healthcare community, healthcare workers.
Hola.
Disculpa,
Sí.
Isabel, tal vez de pronto si apagas tu video, si
Maybe if you
apagas
turn
la
off your
transmisión
video,
para ver si mejoramos un
then
poco
the
la
sound will
voz,
come through.
por favor.
The sound connection might be better if you turn off your video.
Muy entrecortado.
Otherwise, it comes through intermittent. Yes, we have had some internet problems. That's why this is happening.
Adelante de nuevo y una
Well, so let's try again without the video. I apologize. It does seem like it has improved a bit. The audio has improved a bit. Please let me know if there are any other problems, interference.
no, se está cortando de nuevo.
Well, the fact is it's still breaking up.
A ver, Isabel.
Can you hear us, Isabel?
Hola, ¿me escucha?
How about now? It
Sí,
says
ahora
Isabel.
sí te
Can you hear me?
escuchamos. A ver,
Yes, we are hearing you
por
now.
favor.
Please proceed.
Hola, ¿me copian? Por favor, ¿me puede decir si me
Just
escucha?
let me know if you can hear me, says Isabel.
Sí, te estamos escuchando.
Yes, we do hear you.
Hola, ¿me escucha?
Can you hear me?
Hola, ¿me escucha?
Hola. Por favor,
Isabel.
me pueden. ¿Se escucha
Isab-
ahora?
Can you
Sí,
hear
te
me
estamos
now?
escuchando.
Yes, we are
Vamos otra
hearing
vez a ver
you.
si mejoró un poquito
Let's
el ancho de banda.
resume and see if you have more bandwidth left than you did with the video. So what I was saying is first, we had a first meeting gathering with the community health workers to train them, to provide them with the information so they know how to use radio communications and other communication tools, helping them be more reach their communities more effectively daily in the daily work they carry out as health promoters. Community health workers have been very important to us. These are people from the community. They speak the language, they know the culture, they know the context. And the community trusts them because they're well-known elements. In this first stage, they learned how to use the radio so they can broadcast the material that they have. Next, please. Next, please.
Isabel, ya estoy cambiando las láminas. No sé si alcanzas
We
a
are
ver.
changing the screen. I don't know if you're seeing it on your end as having been changed. The prior one, please. Thank you. Different material has been produced, mostly for radio broadcast, given the need to use radio to reach the indigenous communities who live in the countryside. The only messages that get through are by radio. And we use the language adapted to the context of the community And we engage the community to get the community to take part in the contact uh, tracing, videos on the different experiences that we have had in the cities. There's a radio communication network in the Guarani language. There's also a national network, 100, in fact, stations that broadcast that signal from the network. Next slide, please. Now there's a radio program, Ya seré como, which means awakening, waking up. Basically, this is a intercultural dialogue where different local actors take part with healthcare promoters, healthcare personnel, the different teachers and leaders of the indigenous communities, housewives, everyone who feels a part of this iconic venue on Saturdays in the Guarani language. And thus far, a number of programs have been produced, and we continue to carry this out. And hopefully we'll be able to do it next year as well. There's a community radio called Tekove Katu. There's a health school with the same name, Tekove Katu, which makes use of an intercultural model, which works under the aegis of in a health agreement that we have with the ministry. This radio was set up for nursing students to conduct practice drills so that this communication system can be used should it be necessary. Another event was organized for community communicators of the Chaco region. These are 50 local community broadcasters, communicators, as they're called, in the Chaco of the Bolivia. This was a virtual conference in which they addressed guidelines for communicating risk, the importance of vaccination. They talked about the myths that are out there. This is the Chaco region in Bolivia. Are we still having sound trouble?
Sí, te escuchas, ahorita te escuchas como un poco entrecortado. A ver, intentemos de nuevo. Sí puedes.
You are breaking up a little bit.
Intento continuar. En la parte final de esta nuestra presentación, bueno,
At the end of our presentation, we will talk a little bit about the lessons we've learned about these activities, one of which was to strengthen, through this outwork we've done, advocacy work we've done, we've strengthened contact tracing, working in the indigenous communities in the Bolivian Chaco region and the healthcare workers and the community health promoters have worked well together.
lograr que digamos así, las personas que estaban en contra de la vacuna, que
People
no
who
querían
were
hacerse vacunar, pues hayan
against
hayan aceptado
vaccinating
vacunarse.
themselves.
Se ha brindado mucha
That
información
vaccination aversion has been
en el mismo
reduced.
comunitario para lograr que
We've persuaded
las comunidades
through this
accedan a la
effort
vacunación.
to get more and more
Ha
people
sido una importante lección
to
aprendida que
be
no
willing
siempre
to
ha sido a través de
vaccinate.
estos medios, sino que ha
That's
tenido
been a
que
lesson
venir
learned.
de las mismas comunidades,
It's not
del
just
trabajo cotidiano en el
a
día
media
Otra
onslaught, a
recomendación
media
también
message. You
son
have to get out in the
espacios
community and actually work with people to win them over.
de diálogo y de interculturalidad
It's very
que se han
important for there to be
creado
this
tanto en las
space of
radios como
dialogue
los demás eventos
across cultures, using
con
the
los
radio,
de salud,
holding
con las
different
autoridades,
events
la comunidad.
with the community
Eso ha
leaders,
sido lo que nos ha
health
permitido llegar de manera
promoters.
eficaz
That's what has made it possible for us
llegar
to
con los mensajes
effectively
adecuados
reach the
a la
population
población.
and
Por supuesto,
convey
un
the
aprendizaje
right
también
message to them.
hemos visto y evidenciado de manera constante la
Something we've
necesidad que
seen
existe
evidence
de
of
formación y actualización permanente
is how
del
important it is
personal de salud.
for there to be
En las áreas
ongoing
rurales
training,
no tienen la posibilidad de acceder a
especially in the rural communities
información, a capacitaciones,
where people have a harder
lugares donde
time
los COVID estaban
reaching
totalmente abandonados.
wherever they would
Fácilmente
otherwise be able to
podían
get
acceder a
training.
un curso virtual.
Virtual
Hemos
courses
logrado
were
abrir
made
más
available
espacios de capacitación para personal de salud.
for offering this training
Finalmente,
to healthcare workers and
queremos
community
seguir de aquí en
health
adelante
workers. Now, going forward,
promoviendo,
we will continue to
motivando,
promote,
motivando a los
motivating,
promotores,
encouraging
como decíamos,
community health
actores
promoters
además de que realizan un trabajo voluntario
who
totalmente
do this on an
esencial con la
entirely
cooperación económica,
voluntary
dando un
basis.
servicio a su
They
comunidad,
do this just out of a
pero
sense of
con la
service to
esperanza
their
de ser
community.
motivados, capacitados, apoyados constantemente en ese proceso.
And we want to support them
Ello
in
darle
this process.
continuidad a las acciones de comunicación con el programa de Yazarecomo y con las otras acciones que se han producido
With these
para
different
lograr
programs we have, like the Yesere Como,
mejorar
which is a bilingual program,
y
or rather radio, as we talked about before.
que se han diseñado como parte de la ejecución de
We
este
use the
programa,
handbook for monitoring and
crear
contact
pastillas
tracing, the community handbook that was put together for COVID-19 prevention, other worthwhile and useful tools that healthcare personnel and promoters have found quite useful.
que hemos encarado desde el convenio de salud y la Escuela de Salud del Chaco Tecoveco.
Through the Enchaco
Gracias.
Health Service and the agreement that was signed on to there.
Isabel, Francesco,
Thank you, Francesco and Isabel.
gracias por su
We
participación.
thank you very much.
Quisiera abrir el espacio para
Now, I would
preguntas.
like to open up the session for
Dando las gracias también a la
questions.
licenciada Sandra Padilla también por
I
su
thank Sandra
participación.
Padilla for her participation.
Si tenemos preguntas, pueden mantener el video apagado para mejorar
Now, if questions do come in, I would just ask you to keep your video off to make sure that you have as much bandwidth as possible for your voice to get through. You can go to the Q&A on the Zoom platform to ask your questions if you don't want to use the chat. Now, from Costa Rica, from Pamela Monestel, she asks, how did you go about vaccinating people? How much resistance was there? How did you address that resistance on the part of people? Did you make use of traditional doctors in that vaccination process?
Una experiencia de una comunidad, ¿no? Voy a compartir.
There was one community
Sobre la vacuna.
where there was a lot of aversion or resistance to being vaccinated,
Era una comunidad cristiana.
a Christian community,
Culturalmente no aceptaban la vacuna.
which culturally just did not accept vaccines.
Los medios de comunicación, por ejemplo, se ha entrevistado a un pastor de otra comunidad, ¿no? A un pastor.
We enlisted a pastor from another community who was able to explain uh, the importance of vaccination and linking that to faith. He said that God was who made man uh, wise enough to create such a vaccine. So that interview was done by a healthcare promoter, also from another community. The community, when hearing a pastor talk with a healthcare promoter, that helped overcome the resistance to vaccination that this community had. They came to understand how important vaccination is to prevent COVID. So in a single day, we raised coverage from 4% to 52%. So that was a strategy that worked and can be applied, again, within the context of each community. So you have to see how best to reach a given community, making use of key people who could facilitate that message. That experience has been very helpful, enabling us to replicate it in other communities. Taking into account people's cultures and beliefs. And so it's good for that person that you enlist to help you be from the community.
Gracias, licenciada. Y veo que se ha conectado nuestra colega de Bolivia.
Our colleague from Bolivia
Comunicación. Debo
has
decirle en la oficina de Bolivia, Sandra.
connected
Sandra, bienvenida.
Sandra Mayo from Colombia, the PAHO office in Colombia. Thank you very much, Sandra Mayo, for taking part. I give you the floor. A warm welcome to all of the participants. I would like to thank the promoters of this project in Bolivia, the healthcare promoters. I apologize for the connection that we have had. The Chaco region, you must understand, the fact is there are many difficulties there, some of which one of which is a lack of good connectivity in the rural region in Bolivia, and where this project was carried out. Community work is very important for us to ensure that we are able to work with the most vulnerable populations. Now, in the Guarani world, time is circular, not linear. So you have to take the necessary time first for people to understand first the pandemic, how it arrived, and try to help them understand the complexity of these concepts. So you have to understand how complex contact tracing within the context of the pandemic has been. And I'm grateful to all of the people who have taken part in this effort, especially the community health promoters who have worked hard to develop the content for the radio and other outlets and means of communication. It's very important to have a true dialogue, to get community buy-in, engage the community. I thank you, Tanya, the headquarters, for having helped us, PAHO and WHO, for making available to us the financing necessary to carry out this project. I thank you. Hopefully this is a recurring event here whereby we can hear from other countries what their experience has been. Feel free to share your experiences with us during this webinar. Now we have two questions, one from Costa Rica. Luis Antonio Fernandez, I thank you for your question. Luis asks the team in Bolivia, is there an indicator of the effectiveness of the communication process as regards changing the population's behavior and what the usual expectation is of how people will behave? That is, whether they're going to start washing their hands and so forth, other behavioral issues. So that is a big challenge that we have. How to go about changing people's practices and behaviors, and do you have any indicator to gauge whether behaviors have actually changed because of your efforts of communicating risk and so forth? Now, we do know how important the role of the communicators is from the outset to have a good impact, but the information that we have in El Chaco isn't always so consistent. But in those communities where we're working, we've reached a 68% coverage of vaccination, especially in those communities where there's a general consensus and willingness to be vaccinated. That has been a remarkable success, as Sandra was saying, because there had been a huge barrier. Evangelical sects, for example, that prohibited access to vaccines, saying that if you got vaccinated, it can only mean you don't believe in God. And the fact that we reached 68% vaccination coverage in our community and that we have replicated that in others is a watershed event for us. Now, in outreach, it's interesting to identify those communities that just simply seem to be using common sense. Through radio and social media, we've identified these communities. Before, the problem was that people didn't really understand the nature of this disease, of this problem. Then we carried out this communication campaign, made visits to people's homes, and that helped people understand how best to prevent the disease with the guidance of healthcare personnel.
And one final thing, as to the personal attitude one must have, we have to say that here, the community contribution has been very important. We see that there's been a real change. We know that there are constant meetings in the community that used to take place within closed spaces, and now all meetings are done in open spaces, and all of them with the mask, something which never existed before. And another interesting aspect is that as to the family quarantine of cases that are detected or suspicious cases, it's important to mention community participation. The community is supporting the family quarantine. We know that often we don't have access to water or to food in the homes. So through the health promoter, there have been groups organized so that they can bring them different types of services like bringing them water or bringing them corn and help them so that they don't feel alone or discriminated, and that it is a problem that the whole community is living, is all aware of the risks. I also would like to add regarding the communication actions that took place at the very beginning of the whole program. We carried out a brief study to know how much they knew about the contacts and the contagion. We did surveys to see how much the community or the health promoters knew about tracing and what it was for and how it was done. And we used that same questionnaire at the end of the process, and we saw that the knowledge on this has increased considerably. And of course, the new habits that they have acquired, which help avoid the spread of COVID. Thank you very much, Isabel. I think that the vaccination percentage is a clear indication of a change of behavior. If there was a baseline that showed initial resistance to the vaccine, and now I feel that that percentage clearly shows the success of the process you carried out and the clear change in attitude and behavior in the community. We have another question from our colleague Gail Thomas from Pajo in Trinidad and Tobago, who asks about the radio program that was used at a community level. First, asking whether the narrative on the radio and the development of the messages were at all times controlled by the community and health promoters who were part of the group from the very beginning. And if that was so, how were you able to avoid the misinformation from going through? How did you avoid it getting into the program, or how was it dealt with in the program in the right manner? At the beginning, the health promoters were offered training so that they could handle the tools and the phone format. We felt that it was essential to begin the process. The process was designed by the team. We designed it with a variety of formats, informational, musical, drama. So we worked a lot with these formats so that we could reach them in the best possible way. And then slowly, the health promoters were added with news sent from their communities, as well as with interviews done to themselves, telling some life stories, motivating people and serving as an example for other places, getting the health promoters as well as the different community agents involved. The program has a specific format, structure that is well defined and has been maintained as is from the very beginning. Thank you, Isabel. Another comment here from our colleague, Lucy Serrato. I'd like to give her the microphone and allow her to make the comment. She talks about certain actions done in Honduras. Lucy, would you like to talk about your comment? Take the floor and talk to us about it? Lucy? I don't know if Lucy's still connected. I'll read what she sent us so that you all bear it in mind. It says that in Honduras, they worked very hard from the beginning of the pandemic in action, with actions similar to those of the colleagues with contact traces. We did find barriers, including some churches and cosmovisions, but we have obtained a lot of support from the community leaders. Related a bit to what Francesco was saying at the beginning of the presentation when he spoke of how they had to work initially with the balance between the indigenous people's cosmovision and the campaign messages and the different communication activities that were done. I would like to ask a question myself because I'd be very interested in knowing how you were able to get the health promoters and authorities agreed to certain communication processes, which doesn't always happen. They don't always want to be involved in these radio programs. I'm just curious about that. I wonder if you could explain to us how that experience was. But first, I see that there's a colleague from Honduras who's raised her hand and is going to expand on Lucy's comment. Karina, you have the floor. Karina. Don't know what happened with Karina, but Francesca, Isabel, or Licenciada Sandra, could you tell us a little about how you managed to get the health promoters and the other health authorities involved in the communication activities, which I think is a great experience because sometimes there's a lot of resistance and fear of live participation. Tania, can you hear me, Tania? Yes. Can you hear me now? Can you hear me now, Tania? Yes, we now have a microphone. I'm Karina, I've said from Honduras, and my colleague Lucy Cerrato had commented in the chat about all the different actions that we've been doing at a community level, which are very similar to what they've done in Bolivia, in Enchaco. It has been a very gratifying experience. We still have had a lot of barriers because in Honduras, we have 9 indigenous peoples. We've worked very closely with 2 of them, and we've approached the third one. The barrier for us at this time continues to be their low risk perception. And that's a problem socially and the general problem in Honduras. But the contact tracing was an excellent opportunity for us to be able to reach many of these communities. And I want to take advantage of this opportunity to congratulate you and all of you for all these initiatives that help us and motivate us to continue to do this community work and to try to approach these communities. I also want to mention that we are carrying out a project now which has allowed us to approach the communities with health promoters. And we have health promoters identified in the project who are working closely with the community. And I'd like to tell you a little about our experience, if you can give me a few minutes more, Tania, of the translation that we did of the material to the 2 ethnics that we've been working with, which is the Mezquita and the Garifuna. We translated the communications tools that helped us reach them with effective messages in their own language. And that has been quite well accepted and has motivated us to continue to translate these educational materials. And this has had a very positive experience for us to be able to work closely with the leaders that live within the communities, because one of the interesting experiences, and this is the third one that we've had, is that we must work with the leaders in each community. We can't move one leader from one community to another because that's not allowed by many communities. And an example I'd like to mention, which taught us a lot recently, we went into the Honduras Mosquita, which is a remote area difficult to access except via air. And we reached a community where, surprisingly, you cannot do any work with the community leaders themselves. So we had to bring leaders from another community. And in that case, we had an effective message because there was low risk perception. They were not willing to vaccinate. The church was, I'm not going to say exactly what religious denomination it was, but there was a strong religious component preventing the community from vaccinating. So All of these ideas are similar to what you've shared with us in the webinar, and they've been very helpful for us. We want to thank you very much for sharing this knowledge with us. And we wanted to tell you a little bit of what we were doing here in Honduras. We continue to work with my colleague, Lucy Cerrato, and Ramirez, and all the communications team here. We've done a lot of work, very gratifying. We continue to work, we continue to advance, and contact tracing is an effective tool to avoid the spread. Thank you very much for this opportunity, Tanya, and to the whole team. Thank you, Karina, to you. And we'll stay in touch. Maybe at a next edition of this webinar, we can hear Honduras's experience so that you can tell us in greater detail. And now I'll go back to you, Francesco, Sandra, and Isabel, the Bolivian tool. If you can tell us a little bit more about the health promoters and authority promoters' participation in the radio programs. Yes, very interesting what they tell us from Honduras. It somewhat reflects the necessary journey required with these communities. As Sandra rightly said before, we have to begin by hearing, by listening. And the work that we've been doing here in Enchaco for years now is the community multimedia. It's a multifunctional team which is made up of Guarani members who go to the different communities, hearing their needs, listening to them, and sharing with them the problems and the needs. It's a participative activity. Often health is only left to the health professionals, and we don't manage to get the real actors involved, the ones who are really going to be able to change the health system. That's why we think it's a necessary journey that teaches us how to listen, to re-evaluate many of the things that we hear about, like traditional medicine, for example. Often we don't give it the importance it deserves. And we recognize that it's a key element in the day-to-day activity of these communities. And if we don't recover that, we're not going to be able to get into the communities. We have to find a way to give them space. Father Tarcisio always taught us that the example, that setting the example as the 169 agreement of the ILO is to give them all the necessary things so that they can offer their own health services and under their own control, which is a little what we do. We create a space which gives them the opportunity to speak. Often in front of the health professionals, they're a little bit ashamed, they're a little bit shy, they're not willing to talk. Maybe they don't speak the language correctly. Spanish might not be their first language. While with the team, they speak in their own language in Guarani. They sit around the table and they encourage the participation so that it's the community who actually owns the health system, identifying their own priorities and recognizing their own needs. So when we've given these people opportunity to participate in the radio campaign, actually the response has been very broad because the health promoters have been more than willing to participate. We always work together with them through meetings and assemblies. We talk to them, we listen to them, and then we help them define their priorities, and we interview them and hear them. And I can assure you that when there's been flow of misinformation through the media and the social networks or WhatsApp or Facebook or what have you, no one had managed to stop that. Different information came up, fake information came up all the time, and to hear the work of the promoter validated everything that was being said. So, as I said, as they seem to be doing in Honduras, which I think is possible, is to give the communities the floor and hearing them, because they are the ones that have to help change the change. We can only offer a little grain of salt there, but they are the true agents of change in public health. Thank you very much, Francesco. I saw that Gail Thomas had raised her hand. Did you want to speak?
Ask a question or make a comment? Bueno, no sé si Keo
I'm
puede.
not sure if Gail can turn on her microphone. I believe I have to activate them. Let me see if I can do that, she says.
Gail, I just activated the option for you to speak. So you want to go ahead? Bueno, no sé si Gail ya le activé la opción
I have
para.
already given Gail a chance to speak. You have the chance to turn your microphone on, Mrs. Torres, Mrs. Thomas. We have another question in the Q&A asking about the network of the community radio stations that you used for your campaign. Do you feel that that was a strength to prevent the penetration of misinformation about or fake information about COVID-19, having this large network of radio stations at a community level? Do you think that had an influence of acting against or in response to the fake information that was coming through the social networks about the COVID? Yes, without a doubt. That was a strength which we used. These were instruments, these radio stations we used to counteract the misinformation and fake information that was going around, which was often negatively influencing the population, especially on aspects related to the vaccine. So it has definitely been a strength, our using the stations, and it has helped us expand the action, the coverage, because though the project includes 3 intervention municipalities, however, with the radio, we've been able to reach up to 16 municipalities in the Bolivian Chaco, which we said at the beginning is a very large area. Geographically speaking, it's very large, and it has a variety of cultures within the area. So we definitely believe that the use of the radio was very important. Thank you, Isabel. I have one final question to end the webinar, because yesterday we heard the experience from Colombia, where the colleague from Colombia talked to us about the importance of WhatsApp because of the tremendous penetration of WhatsApp in that country. Not only the WhatsApp, but the possibilities of connecting and contacting in remote areas. What we saw from your experience in Bolivia today, which is different from Colombia and specifically in Enchaco, is that the community radios you considered were much more effective than the WhatsApp. I was wondering whether you did any test or any review, or how you got that information. How did you realize that in that region, the main channel was the community radio? Well, in answer, we analyze the situation and our reality. We know that not everyone has the cell phones, not everyone has coverage. And recently, not anyone has the money for it. So we have tried to work with the promoters initially. Some of them do have cell phones and the health staff sending them messages, but we realized that it was really very difficult to share the message with them, the message that was on the cell phone with other people. El Chaco, here we know that the teacher at home, I'm sorry, I'm losing him and I'm trying to figure out what he's trying to say, but his voice is coming in and out. He's talking about the teacher, I think, and we had a program where we were able to prove that the audience was very significant in the communities where we visited. Outside the project, everyone knows about the program, everyone hears it, the radio, I'm imagining he's talking about a radio station, but sometimes with the radio, we don't know how many people you're reaching. And we found that we had reached a lot more people than we thought, and respecting their idiosyncrasy, their language, their context. So in El Chaco, definitely it is the tool of choice to reach the homes of all families. Thank you very much, Francesco, and thank you to the team. And with this, we can appreciate the diversity we must take into account when designing a communication campaign in health. Not all territories use the same platforms. Yesterday, we saw the Colombian experience with a massive communication campaign where they used or are using, and in fact, tomorrow they'll be launching the campaign using the commercial radio and WhatsApp. Colombia also showed us yesterday the other face of the work that they do with the rural communities, where educational and training aspects are so important. And the face-to-face experience was very important for them. And now, hearing from Bolivia and their experience in El Chaco, we see that the cosmovision, the indigenous cosmovision, plays an important role, the oral and traditional, and the radio, the community radio stations, which are so important in Latin America. And I would say that in all of America, but in all of Spanish-speaking America, the radio is historically known as having an important protagonism in health communication or development communication. I want to thank the team from Bolivia very much for their participation. We were able to continue our meeting despite the communications problems. Thank you all for your participation in this webinar. Thank you all for your questions. I put my email on the chat. We're here at the Pan American Health Organization to help any country who may wish to contact us to share their experiences. In the chat, I mentioned that it's not only contact tracing. There are other aspects that have to do with risk communication and response to the COVID-19 pandemic. And we hope that this will be one of many more webinars where we'll have a chance to hear of the experiences of others to enrich our work in the countries and at a regional level. Thank you very much again to all of you. I wish you a good rest of the week, and I hope you enjoy your free afternoon.
Yasuropai Twicha, como dicen en guaraní, muchísimas gracias. Tumpan divino, que Dios lo acompañe y lo cuide en ese trabajo